Ginger Morgan,
Lee Morgan,
Willie Nevels,
Linda Shelley,
Lauren Owl,
Parker Morgan,
Smoking is a very dangerous thing. Once people start smoking, they find it very difficult to stop because cigarettes are highly addictive. There are many health risks that come along with smoking. Some of them are lung cancer, smoker's cough, the loss of body parts, and emphysema. Smoker's cough is when smokers have to clear the tubes in their throat and lungs, which leads to them involuntary coughing. Emphysema is an incurable disease that destroys the tubes and lungs and damages the air sacs. Their cigarettes are full of harmful substances, and these substances are what causes the effects of smoking. Some of the substances are tar, nicotine, and carbon monoxide. Tar causes cancer, nicotine increases cholesterol levels in a person's body, and carbon monoxide reduces the oxygen flow. The gas components in cigarettes can lead to chronic obstructive pulmonary disorder, also known as COPD. Smoking also reduces a person's life expectancy, and people who are trying to conceive that both smoke cigarettes can have trouble with fertility. Another common disease in smokers is asthma. When smokers take medicine for asthma, if they continue to smoke, the smoking will counteract the medicine so they will not be treated. Smoking can cause ulcers in the mouth, and it can also change a person's appearance. It can cause bad breath. It can stain your teeth and your gums. A smoker's wounds will not heal as well as someone who does not smoke, and by the age of 80, people that have smoked for several years usually have developed cataracts. Smoking also causes skin cancer, especially to the face, which can change a person's appearance. Cardiovascular disease is the main cause of death to smokers. Coronary thrombosis, which is caused by smoking, is when there's a blood clot in the arteries that leads to the heart and it causes a heart attack. Cerebral thrombosis, also caused by smoking, is when the vessels to the brain become blocked, which can lead to stroke, collapse, or paralysis. Some people say their reasons for smoking are for stress or because smoking has never done any damage or harm to them. Research has been done, and smoking actually does not relieve stress. Involuntary smoking is the term used for when non-smokers are exposed to secondhand smoke. There are two forms of secondhand smoke. The first one is called side stream smoke, and this is the smoke that comes from a lighted end of a cigarette, cigar, or pipe. The second form is mainstream smoke, which is the smoke that is actually exhaled from the smokers. The side stream smoke is more likely to cause cancer than the mainstream smoke. About 3,400 non-smoking adults die of cancer as a result of being exposed to secondhand smoke every year. And this is a quote that I got from an internet source while doing my paper. Parents who smoke can cause their kids to develop bronchitis, pneumonia, or wheezing. Some states have recently passed indoor clean air laws to cut down the effects of secondhand smoke on other people. Quitting smoking is very difficult, but it can be very beneficial because it improves a person's health. Their heart can work more efficiently after they quit smoking, and their sense of taste and smell also gets better once they've stopped smoking. Here is my visual aid.
look at the phone.
This is how smoking can stain a teeth. This is whiter teeth, and here they've turned yellow after several years of smoking. This is how smoking can age a person. This is the current picture of someone, and this is when they've aged without smoking, and this is a picture of how they would age after they've smoked for several years. This is a picture of a lung, and this is what smoking can do to your lungs. It causes them to turn black and real dark. This is a picture of a lady that smoked for a long time that's now having to have a trach in, and she's smoking through her trach. And then this is a picture of what smoking can do to your teeth. This is mouth cancer.